So we will move on to the next panel, discussing the topic of food safety and regulation. Alors, le prochain panel va discuter des effets sur l'agriculture, la sécurité alimentaire et la régulation. And so I will just welcome our moderator for this panel, Dr. Manisha Mehrotra, who is the Director of Human Safety Division at the Veterinary Drugs Directorate of Health Canada, whose division conducts assessments of human health risks associated with the use of veterinary drugs in food-producing animals. And so let's just give her a round of applause and welcome her.
Good afternoon. Thank you, and kudos to the organizers for organizing this session, and especially the topic. And I have been passionately involved with this topic for the last 15 years, and really understood this is just not just a very simple issue. You know, it does touch on several key areas of our daily life that this issue has been touching. So really very glad to be here and moderate this session. So without further delay, I would like to welcome our first speaker, Dr. Diana Winters, but I believe she will be participating by video conference as her flight got canceled because of our weather here in Ottawa. So welcome Dr. Diana Winters. She's an associate professor of law and Dean's Fellow at Indiana University, McKinney School of Law. And besides her teaching duties, her current research involves judicial review of health and safety regulations and structure of food regulation. So welcome, Dr. Winters. Yes. Okay. Yeah.
Am I there?
Yeah, we can hear you. Okay.
Can you see me?
Yes, yes, we can. Please go ahead. Yeah. Welcome.
I'm not sure what I'm supposed to be doing. Okay, you can see me?
Yes.
Okay, I can't hear anything, so I'll just talk. Can you hear me? Should I start? Hi. Okay. Okay. Thank you. I apologize for this. All the planes were canceled last night, unfortunately. So here I am. So I'm going to talk a little bit. I've heard some of the talks today, and I hope I don't repeat anything. I'm going to talk about and please just somebody let me know if I'm talking too loud or too soft or whatever. So I'm going to talk about the regulation of the use of antibiotics in production, in meat production in the United States, and recent developments in the regulatory landscape. As we heard from Kevin Outerson earlier during his keynote, this is a global problem. The overuse of antibiotics in a subtherapeutic manner in meat production. And so the piece I'm talking about is a tiny little regulatory piece. So there's been a lot of movement in this area over the last couple of years in the United States. In late 2013, the FDA issued a guidance document and a draft rule regarding its voluntary program with drug sponsors to decrease and eventually end the use of medically important antimicrobials for growth promotion in animal feed. And in late 2014, the president released an executive order and a national strategy document on combating antibiotic-resistant bacteria, which Professor Alderson also spoke about. And his Council of Advisors has a significant agricultural presence. And in late 2015, California passed the strictest animal antibiotics law in the country, banning the use of antibiotics for both growth promotion and disease prevention, which FDA's voluntary guidelines don't do, and mandating data collection on the use of antibiotics in animal feed. And so this is interesting because although states have the authority to regulate to protect the health and safety of their citizens, the regulation of animal drugs is under the purview of the FDA. So FDA's inaction in this realm has been a long-standing source of frustration for advocates concerned about the overuse of antibiotics in this realm. So California's action may herald a new way forward for progressive regulation. Now I'm frozen. No, I'm not. Okay. In the absence of this federal action, but it could also signal an era of a patchwork of regulation, which could end up being a problem if the American public turns its attention to the labeling of antibiotics in the way that we are now looking at the labeling of genetically modified ingredients. So, okay, first, I'm going to talk a little bit about the history of the regulation of animal antibiotics by the FDA, and then outline the California law and some potential challenges. Okay, so meat producers have been, and again, forgive me if I'm repeating things that you've heard before, but so meat producers have been adding antibiotics to animal feeds and water in the United States since at least the 1950s to promote growth in animals and to prevent disease spread through the confined and stressful conditions of modern meat production. The FDA has known since at least the 1970s that the subtherapeutic use of antibiotics in animal feed is fostering the growth of antibiotic-resistant organisms, which can be spread to humans. So in 1970, the agency convened a task force that issued its report in 1972, which found that antibiotic resistance prevalence had increased in humans. The use of antibiotics, especially at subtherapeutic levels, so levels that aren't being used to treat active disease, leads to antibiotic-resistant organisms, that animals receiving antibiotics in feed may serve as reservoirs of antibiotic-resistant pathogens that can produce human infections, and that antibiotic-resistant organisms have been found on meat and meat products. And that was 1972. FDA proposed to revoke the approval for the subtherapeutic use of medically important antibiotics in 1973. It called for hearings in 1977. These hearings weren't held. In 2003, FDA proposed to rescind the regulations calling for these hearings, saying that its goal had been reached, that sponsors had submitted data about these medically important antimicrobials. And because over time, FDA had developed a new strategy toward dealing with this, which is its voluntary strategy, which I'll talk about in a second. But between 1973 and 2003, the use of antibiotics in animal feed has only increased. In 1980, it was estimated that 40% of antibiotics produced were for feed additives, and now it's in the realm of 80%. In May 2011, several consumer advocacy organizations sued the FDA, alleging that FDA had withheld agency action and had violated the Food, Drug, and Cosmetic Act and some other statutes by not holding these hearings to revoke the approval of these medically important antibiotics for growth promotion purposes. These organizations won their case at the district level. The judge had very stern words for the FDA. He said, this is a quote, For over 30 years, the agency has been confronted with evidence of the human health risks associated with the widespread subtherapeutic use of antibiotics in food-producing animals. And despite a statutory mandate to ensure the safety of animal drugs, the agency has done shockingly little to address these risks. The judge goes on. Nevertheless, this decision was reversed by the Second Circuit, which agreed with FDA's reasoning as to why it had never held hearings and deferred to FDA's voluntary programs. So these voluntary programs were, FDA was moving forward with these voluntary programs during this lawsuit. And basically, the agency has put forward guidance for drug sponsors to voluntarily stop selling certain antibiotics in animal feed and water for the purpose of growth promotion, and to begin requiring veterinary oversight for the use of these drugs. FDA is not requesting that these drugs be stopped, that use of these drugs be stopped for disease prevention purposes. And as other commentators may have pointed out earlier, the dosage used for disease prevention is often the same as used for growth promotion. And moreover, although veterinary oversight is encouraged, at the same time, FDA has been proposing these voluntary guidelines. It has also relaxed the regulations about veterinary oversight. So these programs have big weaknesses, has been noted by many watchers of this. They rely on the voluntary action of drug companies, the administration of antibiotics to entire herds for sickness prevention is still permitted, and there's this weakening of veterinary oversight, and there's also very little transparency in what the FDA is doing. The biggest loophole is the allowance of medically important antibiotics for disease prevention. And even though the Obama administration made antibiotics a national priority, as we heard about from Professor Outersim, in regards to the use of antibiotics for growth promotion in animals, the strategy doesn't provide the tools or even the rhetoric to support meaningful movement toward decreasing their use. The strategy calls for FDA to continue implementing its voluntary program and to increase educational outreach. And while those are very good goals for us to look to, they're just not enough. And so in October 2015, California, trying to fill these gaps, enacted the first state law that attempts to itself regulate the use of medically important antibiotics in animal feed on the state level. And so effective January 2018, the law will prohibit the use of antibiotics for both growth promotion and routine disease prevention. It does allow for prophylactic use to address an elevated risk of contraction of a particular disease, but it doesn't allow the routine administration of these drugs. And it mandates that medically important antimicrobial drugs shouldn't be administered to livestock without a licensed veterinarian through a prescription or a veterinary feed directive pursuant to a veterinarian client-patient relationship, which under California law is pretty strict. FDA's voluntary plan also calls for veterinary oversight, but it relies on state practice requirements, which vary very widely. And but California's is very strict. So this is a good thing. Perhaps surprisingly to me and other commentators, this law hasn't been challenged. Other California initiatives in the context of food safety have faced challenge from both industry and neighboring states. And regardless, even if it were to be challenged, it is most likely this law would survive a preemption challenge because it is only supplementing FDA regulations here. Yeah, I mean, why it hasn't been challenged is I'm not exactly sure. It may be because the writing's on the wall. We're seeing other private entities move toward moving away from meat produced with the use of antibiotics for subtherapeutic purposes. For example, Chipotle, Panera have moved to using meat raised without the use of antibiotics. McDonald's has said it won't serve chicken raised with medically important antimicrobials. And so producers are financially motivated to move away from the subtherapeutic use of antibiotics. You've also got the possibility that as producers begin producing more meat without this use, production practices will change, which could result in the reduction of the need for the subtherapeutic use of antibiotics. This is a subject very much on the minds and agendas of meat producers right now. And as long as our federal standard remains voluntary and lax, a state-by-state approach supplemented by private action may be our best bet to reduce the use of medically important antimicrobials in meat. And we'll have to see whether California's approach spreads to other states. But where, again, as I said at the beginning, we may see a problem is if we see a call for a national labeling standard and we are relying on a state-by-state patchwork of regulations. But we haven't seen that yet. So thank you, and I look forward to questions whenever they come.
Thank you, Dr. Winters. Really appreciate giving your overview on what's happening in the U.S. and specifically in California. Any questions for Dr. Winters from the audience? So maybe I can ask Dr. Winters, is any other state in the U.S. considering what California has done, in your knowledge?
Not that I know of. And it's interesting because California, although it's a huge producer of food for the United States and elsewhere, it's not one of the top meat or poultry producing states. So I haven't seen calls elsewhere, and perhaps it's not an insignificant amount of meat production, but it's not one of our largest. So perhaps that accounts for the lack of challenge. I don't know.
Question from the panel? Yes.
Hey, Dr. Winters, in the U.S., the use of irradiation is quite, it's highly used. It's not really used in Canada. Is that tied into any antibiotic resistance strategy at all, or is that separate and simply a food safety issue?
Right now, as I've seen, and I would be happy to hear more about it, but I haven't seen it tied to an antibiotic resistance strategy. And we've also seen some pushback from consumers about irradiated goods, and that started to lessen, I'd say, in the last, couple of years because of its effectiveness and safety, but consumers were resistant to that. I'd say about 5 years ago or so, there was some pushback.
Thank you.
You won't see me. I'm off screen. It's Dave Patrick from UBC and a meat eater. First of all, thanks for giving the talk. It was good news for us that the FDA made the move on growth promoters. Normally in Canada, we like to think that we move more quickly, but we don't all the time. And certainly it was easier within a common market for us to move in the same direction. But we were discussing in earlier bits. I'm just trying to get a clear view in net. Whether this change, this elimination of growth promotion is going to be mostly a hollow victory because of, do you expect to see as much of an increase in in prophylaxis as all that? Is it? Are we just playing with semantics? And is California the only place that's getting it right?
Our data collection right now is really poor. So the question of what we're actually going to see is, that's part of the struggle here, is trying to figure out how to get accurate information. But so far, drug sponsors have been cooperating with FDA's voluntary guidelines, but skeptics among us, including me, think that this is because the prophylaxis amounts are the same as the growth promotion amounts. So yes, I think California is the only place getting it right now. Also the lessening of the veterinary oversight and the fact that that FDA is relying on state practice regulations, I think, is a big loophole and will mean that not much is actually changing following FDA's voluntary guidelines.
Science branch, and she has been the main coordinator of this file at CFIA, and we have been working on this for quite some time now. So, Aline, please.
Thank you very much, Manisha. Good afternoon, everyone. Bonjour tout le monde. Je suis très heureuse d'être ici aujourd'hui. I think it's always wonderful to actually meet with university students to talk about issues, because I find that the further we move away from our university days, the little bit stale we get. So it's nice to be refreshed by the thinking of those of you who are still questioning everything. So thank you very much for organizing this day. I'm also very, very sorry for not having been there for a longer part of the day, because judging by the discussion as I was walking in, I think this has been a great exchange, and I hope that you feel that way. I can say for the few minutes I've seen it, I was quite impressed, so thank you for organizing it. The last thing I would say is that AMR is a very important issue, so you might hear me say things that some of my colleagues have said, because if there's one thing all of us federal public servants are doing very well when it comes to AMR, we're all believing in what we're doing, and we're all repeating the messages. We want to make sure people actually do hear what we're doing, because we're doing some really great things, even if it may not be the perfect thing, because the perfect thing doesn't exist. But we are certainly doing a lot, and we are working with our international colleagues to move the issue forward. So please indulge me if you've heard some of these things. I will try to read the room. If I see you snoozing or throwing a tomato, I'll know that you've gone through this before. So, first of all, since we are here in a symposium set up in the space of law, I wanted to clarify one thing, because when I first arrived on this file about a year ago, I was told two things. One, do you know this is really not a new file? We've been talking about it for 60 to 70 years, but somehow the stars haven't yet aligned. But maybe they're finally aligning. So this is an issue that's been around for a very, very long time. And the second thing that I was told is, one thing you need to know, Aline, is that we do not actually regulate resistance. So it's really important to remember that when we talk about antimicrobial resistance, from a legal standpoint, the resistance itself has no standing. So how is it that we actually get to address the resistance issue from a legal standpoint? You've heard the issues around use. So what you're looking at is modulating the use of the antimicrobials, because science shows us that the less antimicrobials you use, less resistance occurs. So you go into that space. The other thing that we actually do regulate is the presence of pathogens, in food in particular. So what we are saying is that if we find a pathogen, let's say salmonella, then we have to act on it because salmonella is an issue. Now, it may happen that that salmonella has also a resistance and confers resistance, but it is not the resistance itself that is legally valuable. And I think it's a very, very important distinction because as you will see, a lot of our actions have to do with modulating, has to do with surveying the pathogens that will therefore give us a sense of the resistance. And that is a very important distinction for us as the public servants who are responsible for enforcing the law. So why don't I quickly skip to, you don't have my presentation, but that's okay. It's okay, don't worry. I've done this before. So as everybody said, AMR is a really, really, really huge issue. Internationally, absolutely every single fora you can think about has found a way to be involved. Do I have control over the presentation? Oh, here we go. So here we are. So what you see here, and I'm assuming there's a little, voila. I like pointers. They're very helpful when you're short and you can't actually reach your slide. So what you actually see here, and if you have magnifying glasses, it talks about the FAO. It talks about Codex, WHO, OIE. If you don't know what all of these are, this is your homework after this. Go and find all the multilateral organizations. But these are essentially multilateral international organizations, and all of them are working in one way or another on AMR. All of them have made a statement about how important it is for countries to address the issue. So as you can see, we have a lot of international interest in the antimicrobial resistance file. And what's really fascinating about this file is that it is one of those files that touches both the human health and the animal agricultural food sector. And so we're actually seeing an incredible amount of work on both sides and coming together. And I know it sounds like a no-brainer. It's a problem for everybody. Let's all work together. It doesn't really happen. It's an illusion. You'll see it doesn't always happen. People don't talk to each other as much as they should. But on this file, people are. And this is a big thing. This is a novelty. When the agricultural and the health sector sit down together and actually talk to public servants from both sides, from ministers from both sides, you know that there's a major issue and we have to work together to address it. So when I arrived, I missed apparently a wonderful debate on our framework, the federal framework on AMR. I hope you guys recorded that. I wish I could listen to it again. So I'm not going to repeat what our framework is about, but I will remind folks that we're talking about three key pillars: surveillance, stewardship, and the innovation part. When we talk about surveillance in the food agricultural sector, because that's what our session is about, we're talking about two types of surveillance. The first one is whether we find resistant genes in foods that are carried by pathogens. And the other part is what kind of use are we doing? So we're surveying the amount of product that is being used. On the stewardship side, which is actually a very important conversation, because the reality is if you change the pattern of use, one of the other very important toolbox in the agricultural sector is husbandry, is how do you manage your animal? How do you manage your herd in order to minimize certain exposures, in order to use alternative methods to help the need for antimicrobials. So again, we're not talking about the resistance itself. We're talking upstream of that. We manage the herd so that they don't actually need the use of antimicrobials. And finally, we have the innovation, which, you know, we have as a separate pillar because we're doing a lot of work, particularly on the genomic side. So we're no longer sort of talking, looking at a product. We're going down to its DNA, understanding how does that resistance transfer from one space to another, understanding how does it move from an animal to a human through the food pathway or other pathways. So all of this work is actually being done in the innovation. And that innovation also supports stewardship and surveillance because it's not just fundamental research, but it is applied research. So today I wanted to take a couple of minutes to talk to you about what we're actually specifically doing under those pillars in the agricultural space, because I think it is very important for you to have a sense of what we're doing, because a lot of them will have legal implications. So when we look at surveillance, what we are looking at, Canada has something called CPARS, and it's really terrible because I'm not very good at remembering what the acronyms mean, but it's the Canadian Integrated Program Antimicrobial Surveillance. Thank you. And Kim saves me all the time with my acronyms. Thank you. So what CPARS does is that it's actually been tracking a number of pieces of information in the agricultural sectors and the food sector around resistance. And that's been going on for actually a long time. We have one of the longest standing programs here in Canada. And in fact, what has been done under the leadership of PHAC is that they've moved from this trending piece of information that PHAC has and collect to looking at all the sources of information that are Canadian and putting together something we now call CARS, which is the Canadian Antimicrobial Resistance Surveillance System, which is a little bit broader than CPARS. But why is it important? Because we're going from a single lens to multiple lenses merged together so we can have a much fulsome picture. On the stewardship side, there's actually some so on the surveillance side, I did say that we have CPARS. I talked about moving on to CARS. We also have a number of surveillance projects that we are now tweaking to include the scanning for resistance genes. But there's also another component. It's the component of the use, and that is where actually my colleague Manisha does a whole lot of work. I think she's dedicated many, many, many years in terms of regulating the drug side. So regulating first in terms of which drugs we can use, but also how do they get prescribed and what are the requirements around them. So in this action plan, actually a number of things have been committed to. The first thing, we actually, as a government, and Manisha has been doing a lot of the heavy lifting, has been actually talking about a greater oversight from the veterinary community on the use of the domestic. And I'm going to actually swish you over to another slide, and I'm going to skip a lot of the things that you've seen already. Hopefully this one didn't give you too much of a headache. I heard you've seen it before. So what I'd like to go here is to actually talk a little bit about what VDD is doing, because it's a very, very important role. First of all, they're strengthening veterinary oversight for medically important. I'm sure you've heard there are multiple categories of antimicrobials. These are the medically important one in food production. They're talking about how we can have the veterinarians more involved. That is actually quite a feat because the laws when it comes to veterinary oversight actually does not reside with the federal government. It resides with the provincial government. So we have to do a lot of negotiations around that. But there's certainly the foundation that can be set up by the federal head of power. Removal of growth, promotion, and production claims. Again, that is something that we committed to in the federal action plan, and we are on track. There's the proposal to do voluntary removal. That's on track, I believe, Manisha. Thank you very much. I want to make sure I give you the latest information. And we're also looking at examining regulatory pathways for low-risk veterinary health products. And the idea is that if you're going to take the medically important one, you need to have alternatives. And so you need a legal pathway that allows you to get those things approved so people can use them. And so VDD has been working closely with us to figure it out. There's also two quick things that I wanted to talk about. Two things that people would consider a bit of a loophole in some case. It's what we lovingly call API and OUI, which is active pharmaceutical ingredient, which we can actually buy across the border and mix. The controls on that are not very strong, so the idea is we need to increase that oversight, and Manisha and her team have been working diligently on that. And the other part is the OUI, which is for your own use, so you can bring things for your own herd. But wait a second, you can have a herd that's humongous, and it may have an impact. So that own use may sound like a very small item, but in fact, when you think about it in the scope of how we manage agriculture in Canada, it can be a big item. And that is why we are looking into this a little bit closely. So you're thinking, Aline, you're at CFIA, why do you keep talking about VDD? Well, because we work hand in hand with VDD. CFIA is responsible for the feed regulations, and in feed, we put medications for animals, so we manage that. But VDD is the one that actually talks about which medication medications are allowed and who has to prescribe them. So we work very closely. Where we have a very important role at CFIA to play is the creation of a monitoring system for AMU. CFIA actually holds the Chief Veterinary Officer position, and so we are leading the development of a way to monitor antimicrobial use. And why is this important? Because in one of those international soup of alphabet that you saw earlier, there's one called the OIE, the Animal Health Organization. And what they're doing is they're trying to standardize across the world what information do we need to collect so we can track the use and compare from country to country. So that is very important, and we are doing that work. Finally, I did talk about the innovation piece, and that is a very important piece because without the fundamental scientific knowledge, we can't actually make good regulatory decisions. So that is why we have it. The last thing I will say, AMR, we said it many times, is a very big file. It doesn't know borders. It does not know sectors. And so the best way to deal with this is to work together. It's to work together across disciplines. It's to work together across boundaries, to work together across seas and oceans. It is really very important. And from a legal perspective, it is important that we have coherence in what we do because, again, they don't know any border. So we have to be very careful that internationally we're thinking it through and having at least some foundational understanding so that we have some commonality across the board. Thank you very much, everyone.
Thank you, Aline. Nice overview of what's happening at the federal level. I'd like to open up the floor for questions for Aline.
Thanks, Aline. Dave Patrick. I've seen that some of the data that you're getting on antibiotics that are going into agriculture. The recommendation to the UKPM was that be a bit more informed by a denominator. In other words, what sector is it being used in per kilo of meat or whatever? Yep. Because the raw numbers right now are really not very instructive.
Thank you. That's very interesting because I don't know how many of you are actually doing law and have done science before or are doing science at the same time. But it's really interesting because with numbers, you can make them say whatever you want. So you have to be careful how you contextualize them and make sure that they make sense. So it is very important that we figure out what that denominator is. And I know that in Canada, we've had a lot of those discussions as well. So we have to find a way internationally to agree on how we're going to do it so we can compare things as opposed to comparing apples and oranges.
Hi, John Conley. Just wanted to ask, how effective is a voluntary ban on the use of antimicrobials as growth promoters? We've had voluntary bans on many things. We know that it didn't work when we asked for voluntary use of helmets for motorcycle riders or seatbelt. It was only when it was legislated and regulated that it actually became effective. So I'd appreciate your comments on the utility or futility of a voluntary ban.
That's a very interesting philosophical discussion. Now, my question, though, is are you allowed to answer as but I think, even if there's a rule, we should break it. Go ahead, Manisha.
Yeah, sure. I'll be happy to take that question. The reason why we are referring voluntary in that statement is that the drug industry actually has come forward and voluntarily agreed to remove those growth promotion claims from those labels. And the second part is whether, as a federal government, we can prohibit any growth promotion uses of these drugs. That's a different discussion. And that, again, goes into the practice of veterinary medicine, and that's something we'll have to address through other means rather than having a specific rule at the federal level to regulate those uses. But I'd like to mention that in the last 15 years or so, none of the antimicrobials that are medically important have got growth promotion claims. These are older products which were approved 3-4 decades ago, and US has the same situation too. At that time, microbiological safety guidelines were not there to assess, so these were approved as growth promotion, but in the last 15 years or so, none of the antimicrobials have got growth promotion claims. So now it's just a matter of bringing these old products at par. So that's, but again, yes, that's work in progress to update these labels and what the products are approved for, and then bring them at par to today's standard and how they are being used.
Sorry, going off the topic of needing to stop the use of antibiotics for growth promotion and even disease prevention, but we're going to need to find alternatives if you're a farmer and you're saying wanting to, even if it is voluntary, you're probably going to want an alternative. And I'm just curious whether or not if there's any ongoing research or just like trials with alternatives. Like one thing that's booming in every area of science seems to be right now is the role of microbiota, and the idea of an alternative being maybe like probiotics and its role in, it seems to be shown in to affect growth, disease prevention. I'm just wondering if you guys are aware of any work on that in the meat industry as an alternative to antibiotic use.
So I think it's a very good question, actually. It's a very important question. I think it's a question that we've all been either asking or asked at some point. But I'm going to make, I guess, a subversive comments. That's when I realize I'm a francophone. So an alternative to antimicrobial is an antimicrobial. A mirror image. What we're looking at when you're talking about probiotics, et cetera, there are things that would diminish the need for antimicrobials because you're enhancing the health of the animal. The reason I'm saying that, and we say alternatives, by the way, even when we talk about alternatives, we talk about vaccines and their research happening there. But I think it is important to remember that, so that when you are thinking about what resistance is about and what the system is about, you actually make that nuanced differentiation. So going back to, are there things being done that would help us address the fact that we don't want them to use as many antimicrobials? Yes, there are. And I know several of my colleagues in Agriculture Canada who have talked about a lot of great work. We have work in universities happening around vaccines. And I would invite the researchers to jump in if there's any particular examples you want to give. But yes, there's a lot of work underway. None of it is definitive, but it's certainly being researched and looked into and examined. So please go ahead. Yes, please.
Well, I know Mark may be able to say more about what's going on with the microbiota, but I'm going back to the broiler chickens. So when they did these first trials on growth promotion in chickens in the 50s and 60s, these were different chickens. So maybe they found something, but the studies would be, Bush League now. They wouldn't be funded by CIHR because they were of no quality at all. A couple of dozen chickens in a lab and a little bit of extra growth, and ta-da, all of a sudden you're using it all over the industry. But between the 50s and the 60s and the present day, there's been a great deal of breeding, Mendelian selection for different chickens. The chickens just naturally grow at a bigger rate now based on their genes and their own internal hormonal structure. And that's probably one reason why there's very little residual benefit from the use of antibiotics in broiler chickens anyway. So I don't know whether that would apply in any other sectors, but yeah, there are definitely other ways to get animals to grow faster, just through breeding.
Fair enough.
Not sure whether you're a law student, but your questions were pretty intense and right on. So there's many activities indeed, but it's an economical problem, yes? So, the farming is... population is growing, the land that is available to grow the animal is getting smaller and smaller, so there will be intensification. And when you have more people or more animals, then the chance of transmission of disease is higher. So in public health, there were three miracles. There was safe water, there was vaccines, there were antibiotics. And now the antibiotic is causing a problem also. So those approaches are indeed being looked at, but the producers need, and they're very willing. And actually, there will be societal pressure. I mean, there were some examples of now customers are requiring antibiotic-free animals. So there is an economical incentive for developing those alternatives. And I think vaccine is a great strategy, but I'm not sure it's going to be the panacea. There will be examples where maybe it won't happen, or the organism will change all the time and vaccines won't be efficient. But I think vaccine is one way forward. But all those aspects of organic farming and then having some food that may have this ecological battle between the good and the bad bacteria, I think this is certainly, but we'll need to show to the producers that this is effective, because the last thing they want is their animal like this. Yes? So they really want to have live animals, and it has to be also economically viable. So there's a price tag, and if the vaccine will go above a certain price, then it may not be efficient. But your questions are right on, and it's really big dollars industry, and we just have to find the right balance. But everybody agrees that if we can reduce the rate of antibiotic users, I think it's a good thing. But we have to provide alternatives to the producers.
So my question goes more towards retailers, because ultimately farmers are producing for a client who they generally have pretty large contracts with. And I'm wondering if any thought had been, like, instead of legislating, because this is a voluntary regime, instead of legislating to hope for some compliance, if there was any way to incentivize retailers to contract with farms who undertake to comply, or who undertake to not use antibiotics. So I wonder because if the consumers do want, like he said, to purchase their meat that has been raised without antibiotics, if there is some way to incentivize that compliance for retailers.
So thank you very much for your question. And actually, Glenford was just saying to me, and we talked yesterday, he's going to be actually talking about a number of these issues. So maybe what we can do is listen to his talk, and then we can come back to your question if there's anything else, so that I think that would be fair.
I think that sounds great.
Excellent.
Any further questions? If not, I think it's a good segue to our next speaker. But before that, I'd like to thank Aline for a good presentation, and it just started the discussions. So our next speaker is Mr. Glenford Jameson. He's a lawyer in Toronto firm that his expertise is right in the domain what we are talking about, the federal and provincial overlap of the regulatory regimes where they overlap, and so he's worked with a number of clients who have faced those issues, and we'd like to welcome him to give his perspectives.
Okay. Go back. All right, we got it. All right, well, I'm the last panelist today, and it's always fun at a conference when you see the topic areas that you can touch on shrinking and shrinking as every speaker goes by. The nice thing about me is the only person who's remotely touched on what I plan to talk about today is this lost student here today. And you also had a fabulous question, and I totally agree with you. I love your question because it brings in sort of my fundamental piece in this topic, which is that this is not a health law problem. This is a food law problem. And really, to get at the root of it, we need to take a systemic approach to this thing. When Dr. Ouellette responded to your comment, or sort of added to it, he was wearing the hat of a land use planning lawyer or an agricultural economist. And when we've got a bunch of medical doctors and lawyers and law students in a room, to get to the best solutions, I think creating a larger tent is really important. So I'd like to thank the organizers and for having me here today. This is great. I'd also like to thank Halifax for giving us a 2-day loan on their winter, which has been a scene, as Diana knows. I'm here to talk to you about, really, first off, about what a food lawyer is, because that's the first question that I usually get. It's not meant to be a show. It's really just to sort of inform you on what the practice area looks like. And then I'd really to talk about how consumers can make a difference here and how regulators can help consumers make that difference. Because if there's no demand for antibiotic or meat that's raised with the use of antibiotics, then this becomes less of an issue at an AMR conference. So first, we'll talk about food law. Food law, for me, is best thought of as a systemic approach or interdisciplinary approach to law. There are a variety of people that self-identify as food lawyers across Canada. Some of them have wildly fascinating practices. There's someone who does almost exclusively fast food contests, and that's how she interfaces with the world of food law. Others are international trade lawyers that deal primarily in the importation or export of meat. And then there's our little firm. To my knowledge, there are 2 lawyers at our firm. We're the only boutique that is focused on this sector. And the best way to understand what we do, which is a little bit different because everyone sort of has their own definition of what being a food lawyer is if you picture along an x-axis food system stakeholders. So resources, producers, processors, distributors, retailers, and users, and then sort of waste. Along the y-axis, we've got a lot of traditional legal tools. What we do at our firm is probably 70% corporate commercial in a fairly traditional manner, but in this sector. So we're talking about transactional work financings. We're talking about contract management between parties. And the other 30% is regulatory based. So interfacing with the CFIA or Health Canada to provide novel food submissions for new foods that had been invented, or temporary marketing authorization letters for all new foods that don't fit into our food regulations or guidelines. And that's really what we do. But the value add for what we do is along that X and Y axis, there are very particular attributes to food businesses. Their structures are often set up in a very particular way to deal with civil liability or regulatory issues. They have a special approach to secrecy or confidential business information. Their valuations and transfers are always pretty unique. And then there's this huge regulatory piece. They've got a highly perishable product typically. And so that's what we do. But I'm here today to talk to you about antibiotic-free labeling in Canada for consumers. Because, I mean, to get to how I opened, if there's no demand for meat raised with antibiotics, then this becomes less of an issue, and our use in this area becomes less of an issue. So we'll do an intro really quick to labeling regulation in Canada. It's illegal to, or it's contrary to the regulations to label anything that's false. You need to be honest. And this raises all kinds of problems, typically, that regulations don't predict. So in the top right corner, we've got cows. There's a big kerfuffle that's brewing right now on what grass-fed beef or dairy means. Rolling Meadow and Harmony Organics are about to have a big fight about this. And there's very little guidance from the CFIA. Rolling Meadow believes that a couple of hours every week outside grazing, when possible, is sufficient to be grass-fed, and Harmony believes something else. That's the kind of stuff that we get into. Equally of battles fought in the past, we've got free-range eggs or cage-free eggs, which are becoming a huge thing. McDonald's is going to be taking them on, I believe, in full in 2017, so in a year's time. So for a supply-managed business or industry to change to deal with that sort of product supply is a big deal, but we have a very clear idea of what that means now. And then we've got this wine bottle on the left, which is Etichetta di Protesta, which is a label of protest in Italian. It's a wine that does not fit certain regulations and was not able to be labeled even table wine, but is actually quite lovely, but was constricted out of what it would otherwise be marketed as. In the same way, we're seeing a lot more statements about where businesses are as to whether their meat was raised with hormones or steroids or antibiotics. And for a long time, there wasn't a whole lot of commentary on this. And as we've seen today, there's a lot of discussion over what a best-case antibiotic-free strategy looks like and what antibiotic-free actually means. And so over the course of our practice, and this is kind of fun, as solicitors, we operate in a total black box, and we're always bound by confidentiality and can't really talk a whole lot about what we do. We've pulled out 3 different contracts where this has come up and come across in our practice. Either we've drafted them or they've just been thrown on our desk to review or comment on. But even if you see here, we've got very different senses of what this might mean. In the bottom right, we've got this fairly pastoral image of pigs and chickens eating purslane, amaranth, and mangoes. And then we've got a single $2.50 junior chicken burger or something, also raised with the use of antibiotics. And so maybe they are treated in different ways. So we've got 3 contracts here, or 3 contract excerpts, clauses. The top one, producer shall not supply purchaser with any pork exposed to any form of antibiotics, completely blanket. The second one, antimicrobial agents shall not be administered in the feed for health or growth promotion purposes. And then the third, the poultry must be raised using practices that do not require routine administration of antibiotics to prevent and control disease. And where this is not feasible, use only antibiotics unrelated to those used in human medicine. Would suggest to me that there are very different ideas about what antibiotic-free may actually mean in practice. The CFI has come up with a statement on exactly what it means. But these contracts, the top one is definitely still in force. I believe the bottom 2 would have expired by now, by about a year. But they sort of demonstrate 3 different approaches to what antibiotic-free might mean. So the top is actually quite an old contract, and it comes from a producer who really services what I like to call sort of the tinfoil hat of the food community, or tinfoil hat wearing of the food community. And that's people that believe that antibiotics exist in your guts and make you obese and change the way you think, et cetera, et cetera. And sort of this is also part of the I'm not a celiac, but I'm allergic to gluten sort of movement, or the anti-vaxxers in sort of a broad sense. It frustrates many people. For me, I don't really care. It gets them to the same place. They're buying meat without the use of antibiotics, so that's great. And because of that, the clause is very dogmatic. The second one is fairly big industry friendly. I mean, it basically says we're not using subtherapeutic antibiotics, which is a great first step, but you shouldn't be using them in the first place anyway. And there's that. It doesn't talk about which antibiotics you should be using or not. And then the last one, I think, is actually a decent science answer, which is like, don't use the antibiotics that we find really important. As I've learned today, those may change over time, but sort of keep a lid on things. And so those have come up in our practice in some way or another. The CFI did a consultation in 2011. It came out, I think, in 2012 or 2013, with this position on it, which is full tinfoil hat, which is wonderful because really it has no place in a lot of meat production. And it just says, no, none. If a calf is gestating inside its mother and the mother gets sick and gets antibiotics, then that is no longer an antibiotic-free calf, even when it's going to market in 2 or 3 years. And that's fairly dogmatic, but that's great and that's wonderful, and we have a statement on where they are. What's troubling as a practitioner, because as a consumer I would like to know what I'm buying, and there's a real utility to labeling laws, particularly in products where we cannot tell for ourselves how a product was treated or made, which is definitely the case with antibiotic-free meat. At least 2 of the contracts in the previous page or previous slide are definitely still in force and are being produced that way and are being marketed to Canadians as antibiotic-free. And in all likelihood, are they? Yeah, in all likelihood, but they're probably not conforming to the Canadian Food Inspection Agency standard. And that's problematic because if you're buying it on a bad science basis or on an ethical basis, you should probably get what you're being advertised. And so at the same time that the consultations were happening, or sort of the standard was coming out, we also had another change in the CFIA from a consumer-level labeling policing strategy. In the 2012 budget, it came down that really the government wanted the consumer to police this thing, where it wasn't a huge risk to consumers. So if it wasn't an allergen or if it wasn't like seriously pathogenic in basis, if it's something like when a food says homemade, but you definitely know it wasn't made at home, like you can call the company and say, hey guys, like you can't do that and here are the rules, or you can call it in the CFIA and they'll sort of manage that conversation for you, which is fine, again, when you can tell, but there's no way for someone to really tell when your meat has been treated or not with antibiotics, and that's problematic. We've also seen a shift in where inspection happens. Generally, for meat, it's been shifted from the feds to the provinces, who typically have fewer resources. That CFIA standard 2 is primarily meant for federally inspected plants or establishments, so plants that involve interprovincial trade or international trade. It's problematic for me as a practitioner because it means that I write these opinions or I sit down with clients and talk to them about what the rules are, and they either say great, or if they don't, they shrug and they say, well, what's the chance of me getting caught? And as a practitioner, like if someone asks you what the speed limit is on a 400 series highway, you say 100 kilometers an hour. And they say, well, what's the chance of me getting caught? And it's like, well, I don't really know. Like there are a bunch of cops out there, and if you're driving 120, like maybe you get pulled over, maybe you don't. It's really tough to tell you that. And sometimes it gets policed and sometimes it doesn't. What that means in the driving example is that we have less of faith in those signs and their meaning. And at a meat production level, it also erodes faith similarly, and makes it harder for them to buy into a lot of the advice that I'm giving them. And a lot of it is really important and relates to food safety in a more immediate way. And so because there's a sort of a limited enforcement of this system, I mean, it sort of pushes me as a consumer or someone who's interested in this type of product to a place where we wonder, well, where could we get so that there's a uniform standard that is enforced, that makes sense? And I mean, the fact is to a degree, one already exists, and that's the organic standard. But the organic standard takes raising antibiotic-free meat from a land use perspective or from a yields perspective and puts it in another universe. Really, a standard upon which an antibiotic-free production of meat would be really helpful. It involves clear rules, it involves certification, it involves sort of an evolving group of best practices for the production of meat. It's opt-in, and really it's something where Health Canada, or if built into this framework of organizations these organizations who are working on this framework, it could involve sort of harmonizing internationally with how antibiotic-free meat is produced, and using that as a template, we sort of ensure better access to markets, and we ensure a certain amount of trust, or a certain degree of trust in the products that people are purchasing. So that's sort of my major piece here today. But to get back to the opener, I think this really is a food law problem. It involves the entire system up and down. We look at the organizations involved in the framework strategy, and we go all the way from the Canadian Food Inspection Agency and Agriculture and Agri-Food to Industry Canada, as it then was known, to the PHAC and Health Canada and the CIHI. This involves a ton of different stakeholders, and it's really important that people from top to bottom are looking at this issue of antibiotic use in agricultural production, both from a market side and from a regulatory containment side. And I mean, today I think that's sort of the one piece that we're missing is how do we communicate to consumers how to operate on best practices to affect some form of containment. And because the use of antibiotics in agricultural production or conventional agricultural production is so great, this seems like a very sensible place to start. So thanks for having me, and there you go. I guess we'll take Manisha here, and we'll do some questions.
Thank you for a very nice presentation, a very different lens to this problem. I'd like to open up the questions. from the floor. Yes, please.
Hi, I'm so glad you introduced the tinfoil hat distinction to demarcate one group of consumers that's interested in antibiotics for a particular reason of immediate direct personal health, or so they see it, versus concern with the larger problem of antibiotic resistance. My question, I guess, is mostly empirical, namely, what do most consumers think they're worried about when they are demanding antibiotic-free meat? Because that taps into a very large problem of public education, because if we're encouraging food companies to, and meat producers to not use antibiotics, and a lot of that is going to be sold to consumers as, this is antibiotic meat, and the consumers think that's a good thing because it's going to directly improve their own health, which I imagine is the reason most consumers think it's a good thing. How are we supposed to manage this challenge of public education when on one hand we want to be honest, on the other, if people probably understood a little more that their own personal health is not at stake with antibiotic resistance, it might create the same problems as, the anti-vaccine movement. Whereas, people can think, I am being rational in not vaccinating my own child, to heck with herd immunity. It's the same problem. How do you convince people to act for the greater good as opposed to their own immediate good, when in this kind of case, there's a real confusion about what's at stake in antibiotic meat?
It's a great question, and it's a really fair comment. I mean, the neat thing about the antibiotic-free meat example is that even the people that are following the worst science, they get to the right place. I mean, this isn't a math test. I don't need to see steps sort of 2 through 6. I just need to see that final answer. So for me, and that's really, this is like a personal values question too, when you're asking me that. As a practitioner, I have no idea. But I know, so with the top one, it was a fairly small outfit that does, good business now, but when they started, they were very small. And there was a significant group of people that were really into community share agriculture, which is wonderful, and really wanted to have control over their food system. And part of it is sort of getting into a gray area in terms of what's good science or not. But you know what, like I had a conversation with someone doing research for The Agenda, the TVO program with Steve Paikin, last week. And the researcher openly admitted, this is a smart guy, that up until he was about 2 hours into it, he realized that it wasn't the health piece, it was the containment strategy piece, which is why Chipotle or McDonald's or any of these other fast food outlets is pushing towards this. So I'd say the misinformation is pervasive and huge, and as a community, we need to do better on informing people. But if it gets you to the same place, then maybe it's not the worst thing. I mean, the anti-vaxxers they're the villains here, as usual.
Yes.
Great. So Glenn, during your presentation, you talked about standards and labeling, and you said it so analytically, so calmly, but this actually sounds like something we should all be really mad about, that we have, as far as what I heard, that we have products that we're buying as consumers, some of which might be labeled antibiotic-free, but actually might not meet any kind of definition of antibiotic-free that a regular human, a regular consumer would have, and that as much as there are some guidelines about labeling, and there's lots of regulations and laws on these subjects, that if industry knows there's no remedy or no effective remedy and very little enforcement, then, well, the rules don't really exist. This sounds like a dramatic issue whereby how are we supposed to know what we're putting in our mouths and affecting our health and population health? Question, I guess, for maybe both, like how is it that the Canadian government isn't taking this on in a more serious way, and what would you like to see the Canadian government do?
Well, as an outsider, I'll hop in and say the $55 million of cuts right after that budget probably helped in not being able to enforce a lot of the rules that are put out there. But I can say that because I don't work for any of the feds or report to any ministers, which is really nice. So I'll throw that out there. And I mean, really, the distinction that I'm making is it's fairly fine, right? It's antibiotic-free, being very clear and never ever experiencing any form of antibiotic, versus in the case that an animal gets sick, receiving some antibiotics, then going back into a flock or a herd, and then being produced is fairly minute. But given that the feds have put out a very clear definition of what this should be, it's really disappointing to see and slightly shocking. It's funny, Dr. Flood talked about, or we were talking about cynicism and optimism, and she's got a wonderful cynicism that would find a great home in the private sector. And so my attitude is, well, a lot of the rules that I come across aren't necessarily adhered to in a perfect way, and there is a greater reliance on consumers to understand their retailers and their retailers' practices, who therefore should understand their distributors' practices, who should understand their processors' practices, and all the way up the stream. And that's part of the work that we do, is trying to make sure that everyone's on the same level. If someone gets sick in one end, we need to figure out, sort of through traceability, where things went wrong. And so that's my piece on it. How about you, Lynn?
So, thank you, Glenford. It's refreshing to have the outsider view. It's always pleasant. So in terms of taking it seriously, I think we are taking it seriously. So one of the things you probably folks don't know is that there's been a very, very, very major review of our labeling approach. So we're going through a labeling modernization initiative, and we've undergone a lot of consultations. And one of the issues that we will be addressing coming out of that, and I know my colleagues have been working diligently on it, is the whole antimicrobial labeling. So how do we say free, use for particular purposes, whatever it may be, they're working on it, because it is an important issue. So I have a very interesting past in that I started my life actually in a consumer group. So I actually got to work on the consumer side. And so it is a very interesting place to be when you've been there and you're in government and you've worked a lot with industry, because the reality is that there isn't enough money in the world to actually cover every single issue. So what really matters is the process of prioritization and understanding what is the risk associated with the different issues. And yes, that includes a societal component of that, understanding the risk for the society, not just the pure scientific. But it is important that we do that prioritization. And I think the whole AMR file is one of those issues that's coming and saying, you know, I need to be present into this conversation, and we are paying attention to it, but it's a huge, huge file. And the reality is, it's a file that can only be addressed if we all do what we have to do. And it may not be perfect, but we all have to intervene in that, and labeling is one component of it. How we manage the system, how we do husbandry, how we prescribe, and I wasn't here this morning, so I may be contradicting some of the health folks, but how we prescribe antimicrobials to humans, like all of that is part of the whole and same equation. So it's very important, and it's multifaceted, and we are working on it, but it's big. And the reality is your voices have to be heard. So that's so as a former consumer person, the one thing that I always found fascinating in Canada, we're not very active from a consumer perspective. Okay? It's a very quiet, very non-controversial consumer movement that we have in Canada. And I'm not advocating that you all go and take arms. That's not it. But what I'm trying to say is that for a government to know what society needs to speak up. It doesn't have to have standoffs, but it needs to speak up. And I think it's important that from a consumer perspective, those voices be raised and people do speak up. So I think that's part and parcel of the societal conversation about what's important and what needs to be managed more closely, less closely.
Just as maybe a quick follow-up, do you think there's an appetite within government for the kind of proposal that Glenn was promoting, of more clearly articulating a standard and that companies can either adhere to or not adhere to, and then advertise and label accordingly? Do you think, is there, yeah?
I'm not going to commit either way, because I don't think it would be appropriate of me to do so. But what I can say is that we're not closing any doors. It is certainly something that can be discussed and can be looked at, because as a government, our first responsibility is to look at all the options and see which one is the best option in terms of addressing the problem at hand, and all of that based on the risk. So certainly I wouldn't close the door to it, and I would say it's part of the mix of things that can be looked at.
I can add to that. Raised without antibiotics is something we are looking into right now from Health Canada's perspective to give advice to CFI. And we are also looking at how do we harmonize or align ourselves with our neighboring countries. So, and as I see, like AMR in especially the agriculture, agri-food context, it's so complex that it's not only food safety issue, it's not only public health issue, it's also trade, economic issue, cultural issue, social issue, as well as legal issue, on top. So there are so many factors influencing how we can make any changes to have a very effective implementation to manage this issue. And especially like from Health Canada side of things, we have been trying to address these own-use importation for these antimicrobial for veterinary drugs. Because if it was a food safety or health issue, we would have resolved it 20 years ago. But it just because it has economic and trade and social, so that involves a lot more players and everybody to be at the same table agreeing to a proposal. So I just wanted to spend a couple of minutes to provide an update on where we are from Health Canada's perspective. So we are working on regulatory amendments to address own-use importation as well as importation for active pharmaceutical ingredients. And hopefully we'll be going to CG1 or gazetting this spring. And also it addresses the comments which our Auditor General had highlighted, as well as these growth promotion phasing out and increasing veterinary oversight of these antimicrobials. Again, as I mentioned earlier, these are the older products. We are trying to bring them up to par because any new medically important antimicrobial, they're all on prescription status in the last 15 years or so. And same issue, like we tried to remove all the growth promotion claims back in 2005 and 2006. But our industry clearly told us that we are not doing anything just for Canada, because Canada is only 2.5% of the global health market, veterinary health market, whereas US is 25%. So we are next to a bigger brother there. So especially our industry is so tightly integrated. So the global aspect also complicates the issue a little bit more. So all these things, we are trying to pull together so to increase stewardship of these antimicrobials from this side. And again, regulations are not going to solve the problem. There are so many other pieces like labeling of these drug products, labeling of food products, and the practice, practice of veterinary medicine, practice of human medicine. So there's a lot more awareness from consumers. Like consumer demand is also going to dictate what's going to happen to this. But again, really appreciate all your input on this, and I think we had really good discussions. So again, thanks to the panelists. Thank you all.
Thanks again to all the panelists. Merci encore. Et je vais juste vous encourager à encore prendre une petite pause d'à peu près 5 minutes. We'll just take a little 5-minute break before our final speaker.